there is a perception that Sonoma is a pretty solidly middle to upper middle class county, and yet we do have disparities, particularly around educational attainment. We have areas that have high school completion rates of almost 100%, and then less than 5 miles away, we have areas that have a low 50%.
And education is so frequently the vehicle to really impact issues of health and income.
So Health Action was started in 2007 with really this idea or this concept of how do we become the healthiest county in California.
And so that council allows us to really look at these issues that affect all of us and bring all of our resources to the table.
We're just the second county in the United States to do a portrait. Through the portrait, what we found is educational levels are very clearly tied to rates of chronic disease, other illnesses, life expectancy, and premature death.
I have heard many more conversations about universal preschool, for example, that I believe are a result of the portrait of Sonoma and the work of Health Action.
You can go into puzzles.
The portrait informs us as we build our own strategic plan about where to open new centers, to relocate services, who else to partner with in those communities, where can we go deeper with our services based on where the need is.
And then we're going to taste the carrots, and we're going to...
The program that we're partnered with the health department is called Ready.
I just want you to eat it and then tell me, what do you think about purple carrots?
The overarching goal of Ready is to connect our school districts to our preschool program so that they're talking.
Raise your hand if you liked purple carrots the best, and I'm going to count.
We're working on that continuum and that bridge into kindergarten for the success of the child and the family.
We're the hub for Latino community and low-income families in Sonoma Valley, specifically in the Springs area. What we try to do is bridge Latinos to opportunities in health, education, and financial security.
Buenas tardes, La Luz Center, soy Walter.
When the Portrait of Sonoma came out and really highlighted the work that La Luz was already doing, we felt that it was just a natural collaboration. We didn't want to start duplicating efforts. We felt that we could align our efforts with that strategy. We could have that impact that we want. La Luz means the light, so we are a little light in this community.
I have a dream. The second I say the portrait, everyone in the room knows what we're talking about. So we can skip that conversation and really move on to then, so what are we going to do about this? How are we going to address the disparity itself? I'm hopeful in 10 years we'll see real change. And if we do it right, then we absolutely will.